Can you touch on what Pfizer is doing recently in terms of AMR, antimicrobial resistance, and particularly efforts in low and middle income countries, things of that nature?
Yes, sure. So we're doing quite a bit actually. And for starters, we are one of the few large pharmaceutical companies that is still active in antibiotic development. And so we are developing new antibiotics to address this challenge. We also are developing vaccines because vaccines prevent infections, and as such, they prevent the use of antibiotics, especially inappropriate use of antibiotics, and in that sense are very important. We also have a very large number of antibiotics and antifungals on the market. We have about 80 different molecules on the market, and so that physicians and healthcare professionals in general have a wide range of products from which to choose, so that the right antibiotic is prescribed for the right disease in the right patient and at the right dose and also for the right duration. And that's actually also the subject of antimicrobial stewardship. That's to ensure that there are rules in place so that the right antibiotics are prescribed for the different resistance patterns in the different parts of the world, different regions or different countries as well. And we have supported the development of antimicrobial stewardship programs and also education related to antimicrobial stewardship and the importance of antimicrobial resistance. And a large part of that is actually supporting surveillance. So we have a program called a database called Atlas that we have about information on about 73 countries in 700 centers in 73 countries collect the information on the resistance of the most important pathogens. And we make this information freely available on the website and also through an app. So anybody can actually check. And this is especially important for healthcare professionals, but also for policymakers, so that they understand what the antimicrobial resistance pattern is in their country or in their region. And what we've seen is that while we were covering a number of countries in Africa, there was really an issue with sub-Saharan Africa, and where up to half of the countries actually have little or no surveillance effort. And we wanted to do something about this. And that's how we launched this initiative called SPIDER, which is actually a public-private partnership with the Wellcome Trust and the governments of Ghana, Kenya, Uganda, and Malawi. And so what we're doing is to build capacity to enhance antimicrobial surveillance based on our Atlas technology. And we're also supporting a real-world evidence study to also look at what is the clinical impact and what is the economic impact of antimicrobial resistance on patients. And that program actually is starting this year. We will start data collection towards the end of this year and have the first batch of data available by mid next year. If all goes well, we've had a little bit of a delay related to COVID-19. We're working through that. And we hope to have a publication of some of the data the year following that, so in 2022. So it's a tremendous undertaking. We've also, so it will help with the national action plans for antimicrobial stewardship and antimicrobial resistance in those countries. It will build capacity, and it will really, in some countries for the first time, provide reliable surveillance data. And so that's specifically for sub-Saharan Africa. Separately, what we're doing also is, we participate in the AMR Action Fund, which has just been launched 2 weeks ago. which is another partnership with the International Federation of Pharmaceutical Manufacturers Associations, IFPMA, Bio, and about 20 companies. And the aim there is on the R&D side to develop between 2 and 4 antibiotics that would come to patients by 2030. Because what we've seen also is that there's a dearth of new antibiotics and R&D focused on antibiotics. And so we're an important contributor to that fund as well.
You mentioned the infrastructural issue in some sub-Saharan African countries where there's not efficient surveillance of antibiotic resistance taking place. Mm-hmm. How does this kind of effort from Pfizer, how does that meet civil society in these countries in the middle, so to speak, about this kind of infrastructural development? Because I know you mentioned, for example, it's not just working with governments, it's a public-private partnership for the Atlas program being applied here.
Yes, no, absolutely. So really what we're doing is, and that's perhaps the most important part of this, is to build capacity for the countries, to enable the countries and the different centers in the countries to actually do surveillance. And so, for instance, the samples will be analyzed both at the local level, at a central lab, regionally, and also globally. And so by doing that, we will be able to train the different countries where this is rolled out, to train them to become better at analyzing the samples and also getting a better picture of the antimicrobial resistance pattern in their center and in the country. That benefits patients as well, of course, because as we better understand, for instance, in a particular hospital, what the antimicrobial resistance looks like, physicians will be able to choose the right antibiotic for a particular patient because they will know what the antimicrobial resistance looks like in their particular hospital and which pathogens are resistant to which antibiotics there.